Hi, this is Dr. Mark Sehl with the YouTube channel Therapy for the Heart. So, we're 75th talk we're on to today, and I'm talking about children. Now, children has been a focus of this YouTube channel since its inception. Um, if the children are our future, so how we treat them, how we behave with them is going to be so essential in their development. And so I want to talk about children who lose a parent, and grief. It's a terrible thing to lose a parent when one is so young. It's a terrible thing for a parent to lose a child, even worse in some ways because they're supposed to survive their child. But tonight we're going to talk about children and bereavement. Children often have a tendency to blame themselves when something happens. It's not rational, but they may have a feeling that I was left because I wasn't good enough. And when the parent dies, it's like you're deserted. And it can bring up all sorts of problems in terms of, we talked a few times about insecure and secure attachments. So if a child has, from the beginning, an insecure attachment, it's going to be worse for that child when their parent dies. So it's a terrible thing for a child to blame itself for that loss. And particularly if it has a tendency to blame itself, and most children do, or many children do, for events that they have no control over and have nothing to do with them, but it's just a human reaction. So at least 5% of children have a parent that dies every year. 5%, 1.5 million, is probably more in the lower socioeconomic classes. And most of them feel like 73% responded that their life would have been much better if they didn't lose a parent, and 60% of the children as adults responded by saying that they lost their childhood because of the death of a parent. So it has some ramifications too, in sense of outcomes, like their children who have lost a parent have more substance abuse, more depression, more lack of trust. Criminal behaviors. So the outcome is far-reaching in terms of behavioral manifestations of psychological problems as a result of the loss of a parent. What are we going to do when a child loses a parent? What should the child be told? It's important to be honest and not lie about it. And studies have shown that if the children are not told the truth, they have a lack of trust. It affects their terms of their being able to be continue with a group versus being a lot isolated. They have loneliness, isolation, ability to express their feelings is affected. So it's important to let the child know what happened and not lie about it. And imagine if you put yourself in a child's position and they're at a funeral or a wake, and they're not told, they don't know really what happened, but they're at the funeral or the wake, and someone says oh, so-and-so died. How is a child supposed to understand that if they weren't prepared? What is that? What is death? One way to explain to a child is that the body, after a certain point, ceases to function, particularly when, parents age, or even not related to age. That's something that happens. But if they hear somebody saying their mother and father died, how are they going to react to that if they're not told? And it's a terrible feeling for the child. You imagine the child feeling, what is going on? So you need to tell the children, you need to inform them. You're not bringing them to a funeral, a wake, and, not saying anything. and honesty is the best policy. So I remember when I was young, I had a aunt, and she was seldom, her name was mentioned, but no one ever talked about who she was, what happened to her, where she was. Now, I never met her when I was young, didn't meet, but in my mind, there was a little bit of an angst, and sort of like a nervousness that nobody talked about where she was. She was in a hospital someplace, and that was about it. So I found out she was in a psychiatric hospital, and I figured it out after a lot of thinking about why they weren't talking about where this aunt was. So I don't think I ever got to meet her. Yeah. But it's terrible when you don't know things. Now, me, I handle it all right because I had a sense that something was, and I guessed, how I guessed, I don't know, that she was in a psychiatric institution, but yeah. So children need to know. They know a lot when they're 3 or 4, and they can tolerate it. What can you do when you know that a family member is around and their child has lost one of their spouses, the father or mother? So you can be very supportive. You can be there for the parent and the child. It's important for the children to have some stability in their life if they can help it, if the family can help it, not to move. Sometimes you can't because maybe the breadwinner was the parent who died and they have to move in order to find new employment. You can't help that. But if the family can, it's important to have some stability and for the child to maintain their friendships, their school, the same school, because their whole world has been disrupted by this loss of a parent. So stability is very important, support of that family, of the child and the mother or father or relatives, siblings. It's very important to tell the teachers and counselors. Now often that is omitted. People forget to do that just don't think about it. They're so much in grief and trying to settle their affairs, so they might not mention to the counselors and the teachers that there was a tremendous loss in their life. And then when the child is important, because when the child is in school, they might tend to act out. They may be angry or just not do work in school as well as they could, or skip school. So the counselors and the teachers need to know this very significant event in this child's life, and I've read that often they're not told. The counselors are not told, so they wonder what's happening with this child all of a sudden that is behaving peculiar. They're not doing their work where they used to. They're acting out, skipping school, depressed, maybe getting in fights with kids. They might be angry that their parent left them and have nowhere to express it because they might not be talking to anybody. Then that's important for that the child to talk about with the remaining parent, to not to intrusively talk about it, but to wait for an opening and then talk about what the child's reaction is to that loss. Do they in fact feel that they were left because they didn't do a good job at school? You never know. Often children do have that feel. My mom and dad fight, and they fight because of me. And then the parent dies, and then, the parent left because of me. And parents do fight with their children in front of their children, and they say all sorts of things that they don't really, they think it's not making an impression, and the parents can't help it. I mean, their intentions are good, but they don't realize the impact of fighting that it has on a child when they hear these voices. And often then they think, my parents are getting divorced, or they're gonna break up. What's gonna happen to me? And it's very terrifying. And then when one of the parents dies, then all these fights happen. Then they could make 1 and 1 equal 2, and it doesn't. But in their mind, it's because everything is connected, and it's not rational, but it's because of me. So you have to be very attuned as a caregiver of the child, interpreting how they interpret the death of a parent. And another thing is that there are not any services for, often for children in treatment. 64%, I think it was 64% of children are depressed. 64.1%, like Mr. One, are depressed. And there's no treatment for them, none at all. So then you take depression and equal that to the significant, sometimes cause of suicide. And the major cause of suicide in death is in teenagers is suicide. I think what it was from ages 10 to 24. Suicide was a major cause of Americans, major cause. So here we have the possibility of that happening because of the depression and how the child is interpreting it, and could be having some suicidal ideation, and we don't have treatment for them. It's terrible. I mean, we're getting the biggest increase in the allocation of funds for defense since the war, the biggest increase, and yet we have these kids who are not getting service because services often get cut back, of course, with mental health and provision of school services and counselors. I mean, that's the most important function that a counselor has, is to be alert to these symptoms that teachers may speak of, and a child is acting out, and the counselor can, hook right in and understand. But the funds are always being cut away for these very essential services that we need in our society. It's very sad. Another statistic. Those hospitalized for mood disorder, 17 and under, jumped 68% over 14 years from 1997 to 2011. 68%. And yet our services are being cut down. We're having an increase in those hospitalized for mood disorders, and yet the increases we're losing, the services that we desperately need. Children, they are our future. Children are our future. We have to take care of them. Very, very, very well intentioned care that we say we're having. It's not being results in terms of the establishment of agencies that can look over these children when they're so young. I remember talking to the class, and they invite professionals to come and say, well, what do you do? And explain it to the class. So I was talking to this class, and I said I was a psychotherapist. And what is a psychotherapist? Well, he listens to people's problems and tries to help them. So the hand shot up and said, well, when my mother and father fight and I have something to say, nobody listens to me. Nobody listens. Another kid says, well, I'm depressed. I have no one to talk to. So here we have a wonderful example of children that can be identified if we have enough resources to locate a problem, watch it, observe it, know how those problems are being come up with symptoms, like acting out, and then do something about it. But there's so many people who have problems, families and children, and so little resources, again, to be able to help them. As 1 in 5 children, 3 to 17, have diagnosable mental, emotional, or behavioral problems. Only 20% are ever diagnosed and receive treatment. Only 20%. 62% of college students have overwhelming anxiety. That's up 50% to 5 years ago. Overwhelming anxiety. Those are college students. Now, when you have overwhelming anxiety, it inhibits functioning. You can function very well, but anxiety, as you know, we talked a lot about anxiety, that it interferes with functioning. And if it's overwhelming, then that interferes with being able to do your work efficiently as you could. And then there's so much emphasis on grades, age 4, 3, 2 now. It's a different culture, isn't it? I know somebody was applied to Friends School for a 3-year-old, a 4-year-old. I don't know how many thousands it was, 10, 15, well, $20,000 to $30,000 a year. Maybe I'm exaggerating, I don't know. It's a huge expense. And, sometimes and I've done research on this, that the private schools are not do much better than the public schools. Of course, that's depends upon where that public school is located, but I know someone said that they went to an interview there, and they said, well, we mostly have doctors and lawyers here, and really? That person said, well, I'm going to reconsider this because I want a varied exposure for my child, not a homogeneous exposure where they're all doctors and lawyers. I mean, there are other people that do things that have a little different take on life, And not that doctors and lawyers only have one take, but that there is. You don't want a homogeneous culture to have your child grow. At least I wouldn't. So our children are very vulnerable. And as we've talked about how vulnerable they are, now their parents are bringing them up, and they do things that they are not so aware of the impact of their children. They can't help it. They're good intentions. It's not their fault. But a lot of children going into school have significant psychological problems because they've been scolded or reprimanded, or their wishes have not been respected in terms of what they would like to do in life. I just had somebody tonight talk to me about his son, and he was not interested in all in what his son wanted to do. It's like he's a dictator, and so regrets of life. The number one regret was I didn't do what I wanted to do. I did what others told me to do. Second regret, I didn't express my feelings. So psychotherapy, there you go. So 2 things, tries to find out what you'd like to do and help you follow that. Not everybody can do what their passion is. I mean, that's true. That's a little idealistic sometimes, but at least give children a chance to follow their passion and also express their feelings. That was a second regret that people had noticed when they were dying, and so expressing your feelings is so important. So we want to help children express their feelings, particularly when events like this happen, like a death of a parent, and be easy with it. Never say, get over it, which I've heard people say to children if they're unhappy about things, to get over it. Move on. That's another one, move on. Yeah. So caregivers are not insensitive, they just are being the way they were taught to be when they had something that's significant in their life and was so, they're so vulnerable to hearing these things, And so much we can do when children are young. You can have a big impact. Like I saw a little girl, and she came in with her parents in the waiting room, and I gave her some chocolates, and she was very happy about that. And then one parent said, well, she's shy, that's why she's not having a difficult time making a choice. I said, oh, yeah, well, it's hard to make choices sometimes. And so later on, they described her as shy. So I saw the mother at another time alone. I said, by the way, it might be a good idea. What do you think of the impact of saying that to the child? And she had a second thought. Well, maybe the child will feel criticized. And I said, well, yeah, that might be. So maybe you could not say that and see what happens. So she did, and for 2 weeks she didn't say anything about her being shy. And she said to me, Dr. Sehl, all of a sudden she's opening up to people that she wouldn't have opened up to before. Yeah. So much impact we have on children. So this is Dr. Mark Sehl of the YouTube channel Therapy for the Heart, and I hope you found this is interesting. And if there's a place where you can like the talk, if you like it, and if you don't like it, you can put you don't like it. But also, if you have a Gmail account, you can make a comment, and I will try to respond to them if they're appropriate. And also, I'm putting things on Friends of Therapy for the Heart, some of the comments. So because they're very interesting, we did a video about the impact of the impact of Therapy for the Heart on people. That's very interesting. I don't know if you watched that, but I think it's the last talk I did. And here's, as a matter of fact, thinking of comments. This was about child abuse in reference to the video on child abuse. And Margaret Wild wrote in. She said, "What a lovely explanation of how crucial it is to look at ourselves as we try to understand and address problems like child abuse." So important, because the tendency is to project everything outside. Like some fundamentalist groups will say, well, we don't have any of those impulses. People have them, other people, but not us. And then you can find out all sorts of things about happening within fundamentalist groups that are not so cool, So thanks for that comment. So I'm going to sign off now, and it's nice to be here again. And I'll put this up tomorrow, Tuesday, which Tuesday's Mark with Mark, right? That's it. I'm a little early to this one. All right. So good night. Arrivederci. Bye bye.